It's, I think, interesting for people to understand where Tommy came from. Tommy and his family were immigrants to Saskatchewan, and they really came in very poor circumstances in the early part of the 20th century prior to the First World War. Now, one of the formative experiences which Tommy talked about later in his career was that he contracted osteomyelitis, an infection of the bone. And as he says later, he was scheduled for an amputation, so he was going to lose his leg. And he was fortunate in that there was a very renowned orthopedic surgeon who happened to notice his case, who happened to take an interest, and who said, look, I will do your case for free and take care of you as long as I can use it as a teaching case for my trainees. And there would have been no way for Tommy and his family to afford that sort of expensive and specialized health care. And so he was always very grateful that he had received this specialist care. But at the same time, he didn't think that it was entirely right or just that he had had this piece of luck, and it had depended upon luck that he should keep his leg. Well, I'll just say a few things about the progression and the genesis of healthcare provincially and then nationally. And I think that there's 2 points that I want to make. One is that the progression of it was much more stepwise than we might realize now. We sort of see our universally funded healthcare system as being one thing. We sort of think, well, someone must have turned on a switch and boom, it was there. But that's not really how it happened at all. It was very step by step. And so first, in the 40s, came the introduction of hospital insurance and publicly funded hospital care. That became a national type of program a decade later, in 57. And it was only in 61, so a decade and a half after hospital insurance, that physicians' services outside of hospital became funded in the province of Saskatchewan, and only some years after that it became a nationally available program. And then the second thing I'll say about the evolution of the healthcare system was that when we look at lots of the CCF's programs in Saskatchewan, it was not only that they were broader and more inclusive and more publicly focused than what had come before them. Part of their success was very much that they were very carefully planned, and there were steps involved in planning these programs which were quite explicit and quite rigorous. And so there would be goals set, there would be priorities set. It was very, very common for the CCF government and for Tommy Douglas to bring in outside experts. And so the interesting thing about the creation of universal health insurance in Saskatchewan was that in many ways it probably did not fulfill that mandate as fully as many of the other programs which existed, or as many of the other healthcare programs which came before the universal funding of physician services in Saskatchewan. And that's kind of at the core of what we consider to be Medicare today. There was a bitter, bitter fight which made it impossible to really plan and rationalize and structure the system in the way that Tommy would have wanted. And he always felt that it was a job half done, that what they had succeeded in doing is removing the financial barrier between patients and healthcare, which was a great achievement, but that what he had always wanted and what had never been done was the creation of a properly planned healthcare system.